Are you someone who craves a career that can have a positive and long-term change on a patient's life? The team at Mitchell County Hospital Health Systems in Beloit joins us now with insights on how registered dietitians can jumpstart a patient's healthy lifestyle.
At Mitchell County Hospital Health Systems, every team plays an important role in the care and recovery of our patients. Dietary department is no exception. Behind every meal is a team dedicated to nourishing the body and supporting the healing process.
Our day begins early as the team prepares nutritious meals for patients, staff, and visitors. Each morning starts with organization, teamwork, and attention to detail, from chopping vegetables to ensuring each tray meets individual dietary needs. It's a fast-paced, rewarding environment where every task matters. One of the most important responsibilities in dietary is making sure every patient receives the right meal for their individual needs. Our team follows physician-ordered diets, whether low-sodium, diabetic, or pureed meals. Our staff ensures each meal is safe, delicious, and meets every person's nutritional and texture requirements. Food isn't just fuel, it's comfort, care, and a vital part of the healing process. When someone is hospitalized, a warm, tasty meal can lift their spirits and support recovery. Our dietary team takes pride in knowing their work directly contributes to better health outcomes and patient satisfaction. A career in dietary is truly about teamwork. Every shift, our cooks and dietary aides work side by side to make sure meals go out in time and nothing is missed. Each day, our team prepares between 250 and 300 meals serving patients, residents, staff, and visitors. A hospital never closes, and neither does our kitchen. Meals are prepared 365 days a year, ensuring every patient receives the nutrition they need, whether it's a holiday, weekend, or the middle of the night. Behind every tray and every menu is a team dedicated to supporting recovery, comfort, and well-being through the power of good food. It's a job that keeps you moving, offers variety, and provides a strong sense of purpose and belonging. Our team also provides meals for employees, visitors, and the community members in the cafeteria, a place to recharge and connect. From our salad bar to new menu features, the dietary staff takes pride in offering fresh, fun options that keep everyone coming back. A career in healthcare food service often begins as a dietary aide, a great opportunity for students or anyone interested in helping others. Success in these roles begin with a positive attitude and a willingness to learn. On-the-job training covers food safety, sanitation, and nutrition guidelines. With experience, team members can advance to cook positions or pursue certifications in food safety, nutrition, or dietary management, opening doors to leadership and long-term careers. While prior food service or culinary experience can be helpful, it's not always required. Many professionals develop their skills through hands-on training and mentorship.
Hi, I'm Kim Jordan, Dietary Director at Mitchell County Hospital Health Systems. I started as a cook at Mitchell County Hospital, working my way up to Dietary Manager, getting my Certified Dietary Manager's license, and now I'm Dietary Director. Throughout my career in food service, I gained a bachelor's degree and an associate's degree in culinary arts and restaurant management. I work with the dietitian to create a 5-week menu cycle that is healthy and comforting for patients, staff, and guests. We also plan special menus for the holidays, parents in our birthing center, and families during times of comfort care. My position oversees the entire department and collaborates with our nursing home to support each resident's nutritional needs, from wound healing and weight management to simply ensuring every meal is enjoyable. Our team also supports special hospital events and community outreach, like the Teddy Bear Clinic for kindergartners, introducing kids to healthcare to encourage healthy habits and provide early exposure to potential career paths. You never know, they might be future dietary professionals.
Our dietary manager oversees food ordering, inventory, and daily production. She also helps coordinate events, supports staff with questions, and ensures our kitchen runs smoothly. The dietary department often serves as a gateway to other healthcare careers, opening doors to opportunities such as certified nursing assistant, laboratory, nursing, and more. Working in dietary builds valuable skills in nutrition, communication, and time management. If you are interested in a hospital dietary position, reach out to your local hospital and see if you can shadow the department. At Mitchell County Hospital Health Systems, our dietary team is more than food service. We are an essential part of the healing process. We believe that food is medicine, strengthening bodies, lifting spirits, and helping make every patient's experience a little more comforting and a lot more pleasant.
I want to welcome our Dietary panel to answer questions about the career opportunities in dietary. Joining us this morning from Mitchell County Hospital Health Systems in Beloit are Kim Jordan, Dietary Director, and April Cadell, Dietary Manager. Good morning.
Good morning. Good morning.
Well, Kim, my first question is for you. You mentioned in the video you worked your way up to the hospital's dietary director position, receiving your certified dietary manager's license while you were on the job. I wondered if you could tell us a little bit about how you've been able to have a career and balance that with advancing your career at the same time.
Well, the great part about working in the hospital is they give us lots of educational opportunities. So as a cook, I started out, I spent 6 years in that position, and then the opportunity came to move up into the dietary manager's job. And so with that came the opportunity to take my certified dietary manager's exam. So the hospital actually, as a condition of my employment, paid for that program. So that was really great that they helped me get that education. I was able to do some of it on site and then continue on from there.
Okay, well, how about you, April? Tell us a little bit about your background and how you became a dietary manager.
I started here out as a dietary aide, moved up to the cook position, and then when the dietary manager position opened, I moved through there, and of course did the same thing as Kim and got my dietary manager's license on the job training through work.
Great. Well, Kim, as the dietary director, we know that you said a lot about the job, but we're wondering a little bit, does every day look about the same, or is there a lot of variety in your day to day?
In dietary, there's a lot of variety day to day. A lot of it depends on, of course, what patients we have. We do have an attached long-term care, so those are a little more with us for the long term. But the inpatient rotates every 3 days, so that's really nice. We get to see different faces and different conditions. And then also it depends on the menu. We have a 5-week menu cycle that I've just recently rolled out a new one. And so there's lots of new menu items and things that we're doing in the cafeteria and for our patients to improve satisfaction for them.
What about for you, April, in your position? Is there a lot of variation?
Most definitely. It depends on the time of the year. If we have catered events, right now the new menu, we have a lot of questions with our cooks and dealing with that on the day today.
So what about nutrition? I'm sure that plays a role in what you do every day in your job. Can you tell a little bit more about how that helps heal the patients?
So much of what we do with our patients is look at their protein needs, their hydration, what their conditions are. And so I work hand in hand with our remote dietitian. She works off site is what remote means. And so with her, she looks at their chart to see if there's any issues. And I look at their patient chart to see what we need to do, whether they need a supplement of extra protein or a snack if they're not eating well. Really, food is medicine. Food is the baseline for what your body needs to heal and to do those things it needs to do. So our goal is to give our patients the best foundation as to what their body needs to hopefully then get them to be able to go home and be successful at home.
Well, I know I have a number more questions, but we have lots of folks in our audience today watching and putting questions in the chat. So I'm going to turn it over to my colleague, Jaron, to see what kind of questions we have in the chat. Jaron?
Yeah, thanks, Cindy. And thank you, April and Ken. This has answered several questions that have already come through already, but one more, if you could help clarify a little, what does your schedule look like in the shifts? Do you work every day? Is somebody working 7 days a week, since obviously hospitals are 24/7 operations? What do those shifts typically might look like?
So our dietary aides and our cooks, if you work a full-time position here, they work 5 days a week. They work every other weekend. So every other weekend you're off. So on those other weeks, you might have a day or two off during the week. Then April and I usually work Monday through Friday, mostly 8 to 5:30, but it depends on the day. and a lot about what the events that we have going on. There are things that take place into the evening or early in the morning. Like we have a doctor's breakfast once a month. So April's in here at 7 a.m. making sure that we've got breakfast out for them to feed the doctors and the staff going to that meeting. And then generally for us, we're on call every other week. So that means we're taking those phone calls and covering staff shortages just like nursing does. So then our schedules may have a little more flux. We may end up working a weekend part of a shift or coming in earlier, staying late to help the department be successful.
That makes a lot of sense. So this question is from Amanda. Maybe April, you might be able to weigh in. Would there be careers in the dietary department that somebody that's 15 or 16 or maybe we'll just say in high school might be able to work?
Yes, of course, we have night kids that kind of start as an aide. A lot of times they do more like dishes and recs, but you could start there, see if you like it.
And get your foot in the door, maybe.
We've had several what has started as night kids work their way up into being full-time dietary aides and even cooks.
Okay, well, that's interesting. Well, good deal. Sounds like that's definitely an opportunity for those across the state might be able to think about getting their foot in the door, whether it's for dietary or something else. Well, the next question from Megan, interesting one. I'm curious to hear your perspectives. Is becoming a vegetarian healthy? Is that something that you would recommend?
I think vegetarian is truly a choice. I think you can get enough nutrition. You really just need to be very aware of your protein needs. And of course, making sure that you are getting enough calcium and iron and those kind of things. We at the hospital see a variety. We've seen vegans, vegetarians, and of course there is several varieties of vegetarians. So it just really depends on what a person truly wants to eat and wants to believe. Everybody has their own needs. And we try to truly accommodate that on the hospital end.
And then the next one from Kylie here, wanting to know, how often do you see the patient that you're providing food for?
We don't see the patient very often in our hospital. Other hospitals, the dietary actually goes in and serves the patient trays, but that's something we don't do here at Mitchell County. I do go in whenever nursing calls me to talk to a patient about their diet, about any concerns they're having with their meals. I also go into our long-term care and talk to patients when they have issues, whether it's trying to figure out like on their quarterly care plan, if they're having wounds, having issues, what their concerns are about food service. So it just really depends on what the need is.
Okay. And you both touched on a little bit of the educational pipelines and backgrounds, but we just got a question. So let's get to this to maybe recap all of that. What are the educational requirements or certifications that you are needing to work in the roles that you have, or those that might be interested in going through that ladder in a dietary department? What do they need to have on their radar in terms of those base job requirements?
So I think one of the biggest things that we see in dietary is truly a desire to learn and a desire to serve. When you look at the overall educational pipeline, we do a lot on the job. So it truly is a willingness to learn. If you want to work your way up, going to culinary school would be a good option. Learning about batch and bulk cooking. Both April and I did on the job and through online for our certified dietary manager's license. If you truly want to go all the way up to RD, then that's of course getting your bachelor's and master's degree. So it truly is multi-leveled on what education level you truly want.
Well, and then maybe time for a couple more questions. This one comes from Hawker Grove Middle School. Do you enjoy doing your job?
Yes, very much.
Yes.
I do.
Yes.
And what
I
are some
love
of
serving patients.
Yeah, love serving patients. Well, good deal. Okay, a couple more here. How do you make hospital food both nutritious and appealing? I think a lot of people here, think of hospital food and kind of like airline food type of a thing. But how do you balance that? And maybe it's not always quite what somebody thinks of, especially for those that maybe haven't been in a hospital and had food in a while.
Well, I think truly that's what makes us very unique is I very much enjoy food. I think you have to be in this position. So it's balancing that nutritional aspect where we might modify the seasonings on something, but still giving them fun food. Like on holidays, we still do turkey and dressing at Thanksgiving, but if you're a low sodium, you might get a low sodium dressing versus the regular. And really, it's all about presentation, making sure the food looks good. And I am very fortunate that we have a wonderful batch of cooks and aides that really try. I mean, they really want the food to look the best and to represent us well.
And so this one comes from Tom. How do you manage meals for patients if they have multiple diet restrictions at one time?
Really, I always tell my staff to look at the most restrictive diet. And so, for example, we'll use diabetic. So someone comes in as a diabetic, but they're also on a low sodium diet. So we're going to, of course, look at the diabetic in first because truly their blood sugars are the most important. And then we're going to modify from there to adjust the seasonings for, okay, they get a low sugar item, but also we need to limit the salt for them. So instead of like a ham, they might get a roast pork, but they're still going to get a full 3-ounce serving because they need the protein because they're diabetic. So we look at, my staff's very good at, if they have questions, me and April are always around to answer and help modify diets because a lot of people come in with what they call comorbidities or several conditions. And so then we need to look at what we can do to make their food both palatable and also acceptable for the patient.
Okay, well, I think we're going to have to call it there. So thank you both very much. And Cindy, I will turn things back over to you.
Thank you so much, Kim and April. Thank you so much for joining us today and sharing your insights on careers in dietary.